the HealthTech Innovation Challenge is a global program. And this year was the biggest program that we've done. We scoured the world to find the best startups. We were across 4 different continents. So we went to Sydney, Australia. We were in Tokyo in Japan. We went to Dublin. And we went to Boston, which is in America. And we had days in each of those where we brought in our industry judges from over 40 different life sciences and health and technology companies, and they came together and they looked at 10 different startups in each of those locations, and they chose the best ones, the ones that they thought were the most viable, the most exciting, with the biggest business challenge, and we brought those to San Francisco this year, and we've been spending the day with them, and we're going to bring them onto stage, and we're going to be awarding 3 of those with an award today. So it's fantastic. It's great that we can share that with you. So I want to just, before I introduce my esteemed colleagues here, I'm just going to quickly run through what we're going to be doing today for the next couple of hours. So to start with, we're going to welcome onto stage Emmanuel Blin, and he's going to come up, and Stuart's going to introduce him. Kaveh is also going to say a few words of thanks. After that, we're going to do a panel. So we're going to have some of our fantastic clients are going to come up, and we're going to really tap into their mind and find out, what they're thinking and how they're dealing with disruption and innovation. And then we're going to have the startups come up and do their pitches. We're going to have 10 startups coming up and pitching. And I want you all to give a lot of energy and give them a lot of support and cheer them along, because they're really nervous. I can see them really scared back there. But they're going to be great. And then we're going to present them with an award. We've also got a special award this year for Novartis, the Novartis Biome Award. So we'll be introducing someone from Novartis who's going to come up to present that award. So I think it's time now for Kaveh.
Thank you, John. Thank you. 4 thank yous. First, all of you, thank you for being here, for missing the beginning of the national championship game. I tried to put it on the screen. I lost that vote. Second thank you is for all of the judges who have participated in this journey, taking us from the beginning, all the regional competitions, to here. Really, this works because of the time and effort that you put into really helping the thinking process and really getting to a good result and learning. Third thank you is for all the technology companies that have gone to the effort of participating in this process and all of the evaluations and all of the demands of taking you out of the market and bringing you here. And the last one is to our Accenture team. None of this would be possible without the dozens of men and women who have worked behind the scenes to make this thing work. And I just want to tell all of you that the work that you do here really matters. It makes all of this work for all of us. We call this an innovation challenge, even though we're in the Startup Festival, and it really represents an evolution of our thinking from the issue of a startup to more the issue of innovation in healthcare. So healthcare and technology and innovation, that's really the thread here. With that, I'd like to introduce Stuart Henderson to lead us into our panel. Thank you, Stuart.
Thanks very much, Kaveh. So thank you. I want to add my thanks to all of you. I'd like to do a little bit of I need your help. So I'm going to introduce Emmanuel Blin, and in order to get your help, I need to get you active. So how many people were here at the Startup Festival this year? Raise your hand if you were here this year. Everyone's hand should go up. That's a clue. If you're struggling, it wasn't a trick question. Okay,
He's not here.
Leave them up. How many people, leave your hand up if you were here last year? Okay, it's quite a few. Leave your hand up if you were here 2 years ago. Okay, I want to thank all of the people here 2 years ago, because the person I'm going to introduce was a judge in our HealthTech Challenge 2 years ago, but he was a very different person at the time. He was one of the corporate people who had spent 20 years in corporate life, and he was, I'd like to think that you, the people with your hands up from 2 years ago, were part of changing his life. And Emmanuel Blin was, he'd been all over the world. He'd run BMS in Japan. He'd been all over Europe. He was the head of commercial in Lawrenceville, in Princeton, New Jersey. He'd done all the roles possible, apart from maybe giving Giovanni a nudge out the door and taking over as CEO. And what he did was, he came to the HealthTech Festival, and he judged the final 5, and he disagreed radically with the results. One of the final 5 was a company called Nuna. It was in the oncology space, patient-reported outcomes. And he said that Nuna was the only one that was really differentiated because everything else could be copied, but Nuna had some secret sauce. Now, he was so convinced, he resigned from Bristol Myers Squibb. So if you're in a corporation today and you're inspired by what you might see, the story you're going to hear from Emmanuel is pretty exciting. He became the chairman and CEO, became the chairman of Nuna, sorry. He was involved in the transaction that sold Nuna to Varian. Nuna is very exciting. It's got a huge customer base now in the industry. It's a great story. He's now the CEO and founder of Tech Care for All. He's going to tell us all about it, and he's going to tell us about his journey from corporate to startup. So I'm going to give you Emmanuel Blin, everyone.
This one, okay. Good. So good evening, everyone. So on my badge here, it's written entrepreneur, and I'm very proud of it. Sometimes it means flying economy, actually all the time. Forgetting about the 5-star hotel, the taxis, and rediscovering subways, buses, public transportation all over the world. So Stuart, I think you stole almost everything I wanted to say. Does it work? Yeah. So actually, you know, I spent 20 years at Bristol Myers Squibb. I did run a lot of commercial operations all over the world. I ended up being the head of commercial for the company, and then I moved into being the chief strategy officer of Bristol Myers Squibb. And at that time, one of the key issues that the company was really trying to address was around how can we leverage all this digital health innovation to actually accelerate commercial and R&D execution. So whilst being a chief strategy officer, I spent a lot of time on the West Coast meeting all the entrepreneurs of digital health, and I became totally fascinated by the energy, the passion, and the ability to transform healthcare that I could see around the world, but starting here in the West Coast on the digital health space. And then Stuart asked me one day, why don't you come to, whilst you are at JP Morgan, why don't you come to become a jury member for the challenge, the Accenture HealthTech Challenge? And I said yes. And that event, for me, changed somehow my life. I met really more deeply quite a lot of entrepreneurs, and I met Nuna. Nuna was a company from Finland, who was run by an outstanding guy called Yanni, and they had this magnificent EPRO tool, patient-reported outcomes in oncology. They had a fantastic platform, a fantastic technology that was really patient-centric, really designed for and by patients. And I said to myself, I need to help these guys. Because these guys, they could not find a model. They could not find a business model. They could not find a commercial model. So when I left BMS, I became the chairman of that company, and essentially to help them really find a business model. We did find a business model. We started to implement it, starting here in the US, especially with a big community oncology network, which is Tennessee Oncology. And the business started to thrive to a point where a big US company, Varian, decided to make an offer that the CEO and the board could not refuse. And I will not give any numbers here, it's private. But the company was then acquired by Varian and now has the financial strength and the global reach to really become a key element of oncology care all over the world, starting in the US and in Europe. And through that journey of being the chairman of Nuna, I realized that digital health is really about two things. It's about finding a business model, which is challenging for a lot of companies, and I'm sure we'll see that today again. It's a challenge to find resources and to have a scalable business model for everyone. And second, it's less about technology and more about how do you actually implement it in an ecosystem. If you want to make it sustainable, to make it used, to really transform the way healthcare is delivered, it's not necessarily about the technology itself, it's really more around how you engage the people, the human beings, and how you are changing behaviors, attitudes, and the way things are done on a daily basis. So I did that, and I decided that my new life was about digital health. And I decided to become an entrepreneur, but a digital health entrepreneur, but of a special kind, a social impact entrepreneur. When I finished my job at BMS, I was really focused on two things. One was digital health, and the other one was helping the company find a way to leverage its immuno-oncology franchise in Africa, and especially for children. Pediatric oncology in Africa is an area of critical unmet need, where there is really almost nothing, and millions of children die every year of cancer that are treated very well in the West, in the North. And it happens that I grew up in Africa. I grew up in Ethiopia, in DRC, and my first job, when I got just married, was to build an orphan school in India. So I decided to get back to my childhood. You never really escape where you are coming from. And I decided to actually focus on how can we, together with a lot of players, how can we enable digital health to really benefit patients, populations who live in countries which are under-resourced, where you don't have, and you will not have in the midterm, enough hospitals, enough doctors, enough nurses, enough healthcare professionals. And when you think about digital health, it can have a disproportionate impact, benefit in those settings, in those countries where actually there is not the healthcare infrastructure and there is not the legacy that we know in the OECD countries. So that's what Tech Care for All is about. It's about commercializing, implementing digital health solutions in Africa and in Asia. So how do we do it? We have implemented quite of a special operating model, if you want, business model. So first of all, I just wanted to introduce you to two people who are very important in the company. Himacare, who a lot of people might know here with our CTO here, and Pam Bolton, who is here with our head of partnerships, with having a very strong NGO background. So what we are doing is we have an operation for West Africa based in Dakar in Senegal in partnership with a local partner called Neurotech. We have an operation for East Africa in Nairobi in Kenya with another partner which is called Savannah Informatics, and we have an operation in Mumbai in India in partnership with COIS, which is an investment fund which has a long legacy of investing in healthcare in India. We have local partners because we need to make things local in those countries to make sure that they work. And we need the local IT infrastructure that they provide. And where we are focused now is we are focused on three areas of high unmet need in those countries. So first is data. How do you capture data? You need EHRs, but not the big Epic systems, Epic-like systems that we know here. We need systems that are frugal, that work online, offline. So we have selected a technology that is a technology that was initiated in the Philippines, then further developed in San Diego, which is called Notes First, which is an EHR system that works online, offline. We have selected to address a second unmet need, which is the need for remote medicine, for telemedicine, another technology that we found in India that is called Remedy, out of Bangalore, that is already used by thousands of dispensaries and health centers in India, that provides on-site, in remote locations, diagnostics and care remotely. It's a kind of suitcase that you can bring anywhere in the world that is connected and can provide patients with diagnostics and remote care. Second big need in those countries. And the third big need is around training. And here we have chosen a technology that is coming from France, that is called InVivox, to which we have plugged an e-learning capability to enable medical learning to be accelerated in those countries and to create centers of excellence in Africa and in Asia where they can exist. Our model is not about reinventing the wheel. There are tons of entrepreneurs all around the world, and we will see some of the best tonight. What we want is to bring the best technologies for those countries that do already exist, that have already been implemented, that do work, that do serve patients, doctors, hospitals somewhere in the world, whether it's in the south or in our countries in the west, and bring them to those countries. And we are focusing on how do we implement those technologies in those countries rather than spending our money on reinventing the wheel and redeveloping EHR number 25 or telemedicine platform number 50. We are trying to find the ones that we think will work, and then we localize them. That's our model. We are getting started. We are funded. We got a seeding round of a little bit more than 2 million euros. We are really getting started now. So if anyone in the room with a digital health entrepreneur wants to get to Africa and to Asia, thinks their technologies can work there, but they don't have time, resources to do it, talk to us. On the other hand, if you want to do something in those countries, because you have programs there, whether you are a pharma company, a med tech company, a government, a foundation, and you really want to leverage all this digital health innovation to actually accelerate healthcare in those countries, talk to us as well. 2 good reasons to talk to me, Hima, or Pam later today or tomorrow. Thank you very much.